2006. Personality disorders and deviant behavior. Introduction. In this study session, you will explore personality disorders and their symptoms. Focus will be on antisocial personality disorder, why it is an important issue in the psychopathology of deviant behavior, and appropriate assessment to identify this disorder. At the end of this study session, you should be able to define personality disorder, recognize psychopathic personality, explain the relationship between psychopathic personality and crime, present how psychopathic personality disorder could be measured and treated. General introduction to personality disorders. Outside of the area of primarily diagnosed mental disorder, Axis 1 is the Diagnostic and Statistical Manual of Mental Disorders, 4th edition, is a number of disorders that can contribute a great deal to criminal behavior and motivation. While these disorders may not be as readily known as the layman, they may in fact cause the majority of criminal behaviors with etiological relationships based in mental disorders. The disorders are characterized as personality disorders, Axis 2, and contain a number of relevant diagnosable conditions. Personality disorders are defined as the stable and enduring maladaptive patterns of behavior which extended to meet up the DSM criteria for personality disorders. We shall examine some of these personality disorders and how they relate to deviance and crime. Paranoid personality disorder is characterized by a pervasive distrust and suspiciousness of others. An individual with this disorder will often interpret others' motives as malevolent. This disorder often begins in early adulthood and is present in a variety of contexts. It is clear how such a disorder could lead to violence. When a person feels someone is motivated to harm them in some manner, it is not surprising that the individual would act in a violent way to either prevent the act they expect to occur or respond aggressively to those they have seen as hostile. They may regard an act of violence manifested as self-defense. Borderline personality disorder, which is possibly the most difficult mental disorder to treat, also can contribute to criminality. While the disorder, which is reflected by a pattern of instability of personal relationships, self-image, affects, and impulsivity, predominantly leads to self-damaging behavior, it also has an external component. These individuals tend to have a marked instability in mood. They characteristically display inappropriate and intense anger and have very little anger control. This constant and recurrent anger and temper is often reflected with a history of physical fights and abuse. Narcissistic personality disorder is characterized by a significant pattern of grandiosity, need for admiration, and lack of empathy. These narcissistic individuals typically care only for themselves and how they appear to others. Typically, this is not reflected in criminality or violent behavior. However, when they are criticized or put down, they may act with disdain, rage, or purposefully defiant counterattacks. This is the bully personality. When they fall, they try to reattain status through any means necessary. This might explain the reason why they could be involved in criminal behaviors. Antisocial personality disorder. One major personality disorder that requires singular treatment in this course is antisocial personality disorder, APD. Also refers to as psychopathic personality. Antisocial personality disorder is the most highly correlated mental disorder with crime. Individuals diagnosed with this disorder are the psychopaths we are familiar with from television shows and movies that have sensationalized these individuals. They are also commonly referred to as sociopaths. Researchers have established that there are many in the society, with nearly 6% of men and 1% of women having the disorder. The criteria for the disorder require an ongoing disregard for the rights of others since the age of 15 years and must be at least 18 years old to receive this diagnosis. People with the disorder appear to be charming at times and make relationships. However, to those people with this disorder, these are relationships in name. They are ended whenever necessary or when it suits them, and the relationships are without depth or meaning, including marriages. They seem to have an innate ability to find the weakness in people and are ready to use these weaknesses to their own end through deceit, manipulation, or intimidation, and gain pleasure from doing so. They appear to be incapable of any true emotion, from love to shame or to guilt. These individuals are quick to anger, but just as quick to let it go without holding grudges. No matter what emotional states they have, it has no bearing on their future action or attitudes. They are rarely able to have jobs that will be for any length of time because they become easily bored and instead will need constant change. People with this disorder live for the moment, forgetting the past and having no plan for the future, nor thinking ahead of what consequences their actions would have. They want immediate reward and gratification for their needs. Relationship of antisocial personality disorder with crime and deviance. An individual with antisocial personality disorder has a pervasive pattern of disregard for the rights of others and violations of them. The disorder is characterized by a lack of conformity or respect for lawful behavior. They repeatedly carry out acts that are grounds for their arrest. There is extremely high tendency for such an individual to be deceitful. They will often be found to be using aliases, repeatedly lying, and conning people for either profit or even pleasure alone. An individual with the disorder tends to be irritable, aggressive, participates repeatedly in physical fights or assaults, and displays a consistently reckless disregard for the safety of their self or others. Finally, these individuals tend to lack remorse as displayed by their indifference for harming others. Why this disorder would contribute greatly to criminal behavior is clear. It itself is a recipe for criminality. Measurement and treatment for psychopathic personality disorder. The use of measurements is critical in psychology. Some instruments that have been used in the past to identify this disorder include Minnesota Multiphasic Personality Inventory (MMPI) by Hathaway, S. and McKinley J. 1967, particularly the Psychopathic Deviate Scale, 50 items, Insec Personality Questionnaire (EPQ) by Isaac Insec and Insec 1995, containing 90 items, and California Personality Inventory (CPI), particularly the Socialization Subscale by Go 1954. Because antisocial would always blame others for their problems, have a low tolerance for frustration, are impulsive and rarely form trusting relationships, working with these individuals would be difficult. People with psychopathic personality often lack the motivation to improve and are notoriously poor self-observers. In other words, they do not have insight to their problems. They simply do not see themselves as others do. Psychotherapy for people with APD should focus on helping the individual understand the nature and consequences of his disorder so he can be helped to control his behavior. Exploratory or insight-oriented forms of psychotherapy are generally not helpful to people with APD. Therapists must be aware of their own feeling and remain vigilant to prevent their emotional responses to their patients from disrupting the therapy process. No matter how determined the therapist may be to help an antisocial patient, it is possible that the patient's criminal past, irresponsibility, and unpredictable tendency towards violence may render him thoroughly unlikable. Experience of the therapist counts a lot in the treatment of people with APD. Their treatment will require someone who can anticipate their emotion and present an attitude of acceptance without moralizing. One of the most effective psychotherapists found beneficial to individuals with ADP is cognitive therapy. This therapy was first developed to help patients with depression, but it has recently been applied to APD. During the course of the treatment, the therapist should set guidelines for the patient's involvement, including regular attendance, active participation, and completion of any necessary work outside of office hours. The individual with APD who submits to therapy only to avoid a jail term is not intent on improving. Therapy must be more than a means by which the antisocial tries to elude the consequences of his behavior. The cognitive therapy's major goal is to help the patient understand how he creates his own problems and how his distorted perceptions prevent him from seeing himself the way others view him. Study session summary. In this study session, we examined personality disorder and deviant behavior. In the course of the study session, we defined personality disorder, showed the symptoms of the phenomenon, as well as discussed types of personality disorders. Finally, we examined psychopathic personality and looked at the measurements and the procedures of its treatment. End of study session 6.